Good morning, everybody.
Good morning.
Just giving a couple of minutes to everyone to join in. I've got a few which have joined. Thank you for joining.
Good morning.
Good morning. How are you doing?
Okay.
Good morning.
Mr. Aslam, how are you enjoying? Are you enjoying the sessions? Are you gaining some knowledge?
Yes, brother. Yes.
Good stuff.
Everything okay.
Good stuff. So do ask questions if you know some of the things. Sometimes if you don't understand, please do ask questions. No right, no wrong questions. Every question is a good question. So feel free to ask questions when you're in the session.
Okay, mate. Okay.
Okay, so I'll give it a couple of more seconds. Feel free to ask questions, and then we'll start. Okay, we'll be starting shortly. Okay, so let's start for the benefit of those who have joined. Without further ado, let's make a start. Today we are looking at covering Learning Outcome 2, which is from yesterday when we started the new unit, health and social care sector, one of the core units, in this particular course. So today we are going to be looking at discussing, further on the legislation and the professional code of conduct which is required when people work within this particular sector. So it's a case of looking at understanding, some of the key acts and legislation that we have looked at previously. And we are going to be discussing them in a bit more detail today, just to make sure that, we have a good understanding on, obviously looking at the, key legislation, acts and regulations which are, required. So let's start. And we will take it from there. Just basics of housekeeping tips to ensure that, we are keeping our mics muted when just to keep the background noise in check. As I will press record shortly to start the recording of the session. Should you wish to need to look at revisiting this recording again, this particular session is being, broadcasted live on YouTube, and obviously the session is then available, for most users to be able to revisit and obviously revise at any given point in time. So just to briefly show you, some of you may find this it might be a bit new for some of you, but just looking at showing how you can go across and obviously look at this session live on YouTube. So as you can see in my browser on the YouTube right now, this is the current session that we are broadcasting live. And if somebody is to click on this, should be able to join the session from here as well. Now, looking at pressing record, and I would mute everybody's microphone if that's okay. And we will make a start. So let me just bring you back to, the unit specification. All right. So just looking at, thanks for joining in today for this second discussion on the second learning outcome for the health and social care sector unit. Now, yesterday, just a quick bit of recap, in terms of what we covered yesterday. We did a bit of a unit introduction to understand what is health and social care sector, what comprises of health and social care sector in the UK, what could be the various job opportunities and different types of people which work in various roles and responsibilities within the sector. We typically looked at understanding how the NHS and the health and social care sector is essentially set up, and within the health and social care setup, where is the positioning of the NHS, some of the key regulators like CQC. We look at the National Institute of Care, Health and Excellence, and some of the bodies which primarily work very closely under the Department of Health to be able to provide these services to the members of public in the UK. Now, there is not much difference between how the setup is, but primarily for the purposes of understanding and reading, we discussed the structure of the, we discussed the health and social care structure predominantly in England. It is not very different in Wales, Northern Ireland, and Scotland, because obviously United Kingdom is a devolved nation of 4 countries. So there are some adaptations, and obviously, they might be slightly differing in terms of the structures, but essentially it is the Department of Health, the Health Secretary, Steve Barclay, that we discussed, and they are the ones which predominantly run the services in the UK. Now, underneath that, we looked at the organogram, and with the organogram, we looked at how this particular, setup is there. So under the Department of Health, you have the NHS National Health Service, the NHS Constitution, the NHS Act. You have local authorities. You have the local, commissioning groups. You have hospitals, A&Es, and some of the regulators which basically sit independently outside and regulate policies, decide on, and undertaking research, and obviously from time to time suggest changes which could be done in order to make sure that the services being provided in terms of care are tailored, for the, individuals. So we looked at understanding role and regulator of watchdogs, specifically CQC. We also looked at the roles and responsibilities of different individuals, which work within this sector. It could be occupational therapists, it could be nurses, doctors. So it's not just nurses and doctors that we talked about in this sector which work. There are lots of different types of people which tend to work within this sector, and they essentially, are also a part and parcel and are key part in terms of making sure that, the delivery of the services done to the members of public. We looked at then understanding, why is CPD important? Anybody recall career professional development? Why is training and development a very important part of this particular sector? Reasons being that you have to upskill, make sure that the people working within the sector who are providing services are up to date with their knowledge and skills on working in terms of operating equipment or providing services to patients. And obviously lots of focus is on training and development from the employers, especially the NHS. And we looked at within the NHS structure that there is a training component of it, which is where the NHS focuses on making sure that all employee staffs are essentially very well trained when they are working and delivering their roles and responsibilities. The key aspect on the learning outcome one was to primarily understand named sector organizations. So that is where we took an example of the ATHE care home in Cheadle, because some of the tasks, essentially, if you see, would talk about a named health and social care organization. And what we need to be able to do is not generically, but related to a specific setup, talk about the structure and the roles and responsibilities of an individual working within that setup. Now, with that being covered, we are going to go into a bit more detail today into learning outcome 2, which talks about investigating how current legislation and professional codes of conduct impact the delivery of health and social care services within a setup or within a care home or a hospital and things like that. There are 2 assessment criteria that we are looking at covering. One is explaining how the current legislation impacts health and social care provision in a chosen setting. So again, the focus is here on looking at choosing an organization. We cannot generically talk about it, but we have to choose a setting like a care home, a hospital, a GP surgery, a community healthcare center, or some sort of a setup in which we are going to be discussing this and how the legislations are followed and what legislations are required to be followed to ensure that the patient safety is maintained, and also ensuring that the services in terms of care is delivered to the patients. The second part talks about understanding the UK care standards. So this is where we'll be looking at understanding, the care standards in terms of the 7 Cs or the different standards which have come up and have been drawn up over the years in terms of care standards. And this basically include, the 15 standards that we talk about. If somebody is to ask you a question, what are UK care standards? There are 15 standards. This basically relate to understanding how you can best deliver and work within this sector. And they start from understanding your role, your personal development, your duty of care, equality and diversity, working in a person-centered way, which is going back to the first unit where we learned the 6 principles of person-centered approach or care, communication, privacy, dignity, understanding awareness of mental health, safeguarding, basic, life support, health and safety, how to handle information and ensure data, patient data is protected in terms of, data protection, and then looking at infection prevention and control. Now, when we look at the care standards, what we are also going to be doing is for all the health and social care students, we are going to ask you to do a free course with us. And that free course is going to provide you a certification. And that certification is going to come from, the SCIE, if I look at, the full form, Social Care Institute for Excellence. This is again a semi-governmental body which looks at providing, sharing, producing and supporting, information related to employees, individual staff working within the sector. So I'm going to show you in terms of how you're going to be looking at doing this particular course with us. This particular course is going to be related to, infection prevention and control. And this is going to be a free course. And this is something, if you complete with us, you'll be looking at getting, certification from SCIE. And that would be quite useful for some of you who are going to be looking at, developing a career within the health and social care sector. So this is something which is going to be in addition to what we will be looking at covering. And I will just give you a small glimpse of what you will be looking at when you do this course. This is the course which is going to be on, which is going to be an infection control. It's a free course that we're going to be offering, and we'll be setting up logins for you to be able to understand how infection control and spread can be done, and is going to be quite useful for you as an add-on secondary certification or a qualification I would put it this way, a skill that you can add on your CV to say, I have a certificate in infection control and prevention as well. And that would be quite useful. So details about this is something which I will share with you as we go along. And what we are going to look at now is getting into, the presentation slides to discuss some of the assessment criteria. It's got 2 assessment criteria in the past, and there is one which is in merit, which talks about explaining the relationship between healthcare values or health values and care values. So here we are going to be looking at understanding person-centered approach values and also care standards, the 15 care standards which have been drawn up, and what are the values and what is the relationship between the two and how they are related. So a simple enough learning outcome today with regards to coverage, 3 assessment criteria. And let me just switch over to the PowerPoint presentation, which is what I'm going to be using to discuss some of these, assessment criteria. Now, this is the second session that we are looking at doing, focused predominantly on understanding current legislation, professional code of practice, and the care standards which have been drawn up. Now, the first thing that we want to understand in terms of, certain acts and regulation. There is obviously lots of them. What we want to be able to do is primarily look at studying them, because some of them you have to understand them from a theoretical perspective. There is no no rocket science or not much explanation that can be done. But these are acts which are required to be followed and essentially required to be used as and observed and put into practice, as you basically work as a healthcare professional within this sector. Now, first of all, let's look at why is legislation important? Why is legislation required? Sorry, just having a cup of tea as well along with it. But if we look at very broadly, what is legislation and the meaning of the word legislation? Legislation, as we discussed yesterday, was basically a set of rules, a code book, laws which are basically created by the government in any country, and it allows them to use these legislation to basically govern and make certain key features like key acts applicable in a country. So when we talk about legislation, it is a set of laws which have been passed in the parliament, and this is used to primarily run certain set of operations within a particular sector. So when we talk about the Data Protection Act, when we talk about Health and Safety Act, we talk about safeguarding, we talk about Equality and Diversity, Equal Wage Act. These are all acts or legislations which have been created in the parliament. They have been passed in the parliament, and now they have to be observed at places of work in order to ensure that members of the public are basically following these guidelines set in order to provide services in an effective and in a prescribed manner. So in general, when we talk about the word legislation, straight away, something which comes to your mind should be laws and rules made by the government. Now, these rules are essentially to be observed. They are essentially enacted in order to help the government govern the country, and in various departments. So in the Health and Social Care Department, when we talk about, there are lots of different legislations which have been introduced, and these legislations have been introduced primarily to ensure that the proper guidance is provided in order to make sure that all people working within the sector are safe, and also this guidance is to be observed in order to ensure that the quality of service is maintained while the care is being provided to the members of the public. Now, there are lots of different types of legislations that we look at, in the health and social care sector. Some of these legislations, which are put down as a bit of a slide here, cover things like health and safety, Food Safety Act, you have food safety regulations, you have control of hazardous substances. There is something called RIDDOR, RIDDOR, which is a short form for reporting of injuries, diseases, dangerous occurrences, regulation. You have manual handling operations and regulation. Sometimes we have observed that when you are in, say, a grocery store, if you have gone out for shopping to B&Q or some of the other places, if you have equipment or things that you're trying to pick up which are more than 20 kg in weight, there are certain guidelines that the staff in the location or in the outlet observe, and this is primarily looking at a basic pretext of manual handling operations regulation to ensure that people do not injure their back or do not obviously hurt themselves when they're handling load or weight of goods which are heavier than 20 kg. So there are lots of different types of legislations which have been included, and they have been included to ensure that people are safe, patients are safe, family members or patients receiving care in the healthcare setup are safe, and they are receiving the services to a required standard. Now, it is important when you work within the sector that you need to have knowledge about the current legislation. You're also expected to understand how important, what is the importance of adhering or, utilizing and implementing these legislations at your place of work. Simply put, an example would be if you are dealing with children or, you're a practitioner in the early years as somebody working within the sector, you need to be aware of safeguarding. So you need to be aware of certain principles which are required, and they would be looking at helping you meet the standards. And also, if the standards are not being met, then there are consequences, and these are bits which are covered in the legislation. Now, if we look at some of the important ones that we want to cover with regards to some of the statutory regulation that which need to be followed, they are going to be a few that I've listed down here for the purposes of covering the assessment criteria 2.1. So key legislations that we are looking at is health and safety, safeguarding, equality and human rights. And we are looking at obviously also understanding and relating them to the structure and the function of NHS, where these legislations, and acts are important, where these laws are enacted, and where in what places they become important, and why they are to be followed in order to reduce, for example, injuries. In order for when these acts, policies, procedures are followed, they basically ensure that the right amount of care is being provided, it's being delivered effectively, patients are able to benefit from it, and providers are able to, when inspections happen, they are able to meet the inspection guidelines because all the relevant standards have been implemented within the place of work or at an organization, at the organizational level. Now, if I go into the Health and Safety Act, this is also sometimes called the HASFA, Health and Safety Act, and this is one of the most important acts that we are looking at understanding when we talk about legislation. Now, this act basically ensures, and when we look at this particular act, what we are looking at is this particular act was essentially introduced by the government in the 1970s, and this was introduced primarily to ensure that if there are people working within a particular setup, employers have there are some duties which employees have, and there are some duties which employers have. And in order to ensure that everybody is safe at work, this piece of legislation, which was introduced, in the early 1970s, and is become a mandatory, requirement for all employers and the members of the public to follow, ensures that that people are safe at their place of work, and there is adequate safety provided by the employer, and then a safe working environment is provided to all people working within the health and social care setup. Now, this particular legislation is applicable across all businesses, all organizations, not just generally the health and social care sector. So the HASWA, or HAS, in short, HASAWA Act, is an important piece of legislation because this particular piece of legislation, ensures that employers provide a safe working environment and look out for the health of their employees wherever the place of work be. Now, it also relates to making sure that well-being is not only just for permanent staff, but it also is applicable for casual staff, contractor staff, or people who are working on a self-employed basis, temporary workers, and even visitors who are coming into the premises for the purposes of meeting the patients or, visiting their near tier ones. Now, there are lots of important things related to this act. There are a few that I will quickly, go through. There is a handout on this particular act, which I will provide, which is a 2-page handout. And the bits that I will cover, some parts of them will essentially come from there. Now, when somebody refers to HASWA, you should be able to straight away look at that this is an act passed by the government in 1974. It deals with providing a safe working environment and has certain responsibilities for employers and for employees. Now, the main bits in this act typically include provide a safe working place. You need to be able to use the equipment safely. For example, when we look at offices and when we look at the setups, sometimes you would see that in the case of electrical equipment, there is pack testing which is required to be done to ensure that the fuses and the electrical wiring and everything is suitable and is absolutely fit for purpose. And these are things which are required to be covered under this particular act so that you don't get a shock or don't get injured by using certain equipment. So the Act looks at certain principles, and these principles include providing a safe place of work, providing safe equipment, ensuring that the employer is able to provide training if you're required to operate certain equipment. People working within this particular setup, say if you work in a hospital, you operate the MRI machine, you operate the X-ray machine, you need to be provided with proper training and instructions to be able to use that machine so that equipment that you are aware of and you're going to be using on a day in, day out basis, the employer has provided you training on it so that when you operate the equipment, you feel safe. And when you are providing services to the members of the public, patients who are coming in, they are also not put in the harm's way. Now, there are risk assessments which are required to be done. Now, how do we ascertain that this place is safe for work, or there is no damp in this place, or there is proper ventilation, proper lighting in this place? There are risk assessments which are required to be done, and that is normally carried out by the health and safety, somebody who's responsible for health and safety within the organization. And these risk assessments are primarily done on a yearly basis. Things like when you look at hearing a fire alarm or a fire drill, which tends to happen in a premise, is being done primarily to ensure that in the event of a fire, there is proper evacuation plan. Everybody knows what is to be done. And the reason of this drill that is carried out in organizations is to ensure that people are aware of, in the event of fire, what steps have to be taken in terms of ensuring everyone's, safety. So from our point of view, when we look at this act, there are responsibilities of employers, there are responsibilities of employees working within a particular location, members of the public which are visiting that location, and they are covered under this particular act to ensure that everybody is safe when they are, say, for example, visiting a location or a setup, and they are generally safe and, they feel safe when they are working within that environment. An employer is required to provide proper facilities to ensure that, if, say, for example, there are kitchen facilities, there are kitchenettes or sitting facilities for the employees to be able to have lunch or dinner. And if the setup like a hospital, which has shifts, there should be proper facilities provided, by, the employer to ensure that, it covers the basics of like toilets being clean, drinking water is available, heating and proper air conditioning is provided in certain locations like the intensive care unit, or where obviously, patients are being kept, after a surgery. So all these things need to be looked at from a point of view of ensuring that, the whereabouts and obviously the individuals feel safe when they are, working within a particular setup in the organization. And that's the whole purpose of ensuring and implementing the Health and Safety at Work Act of 1974. Now, obviously, in order to oversee the implementation of the guidelines of health and safety, the organizations need to also have a competent person to oversee this particular standards. So somebody who's dedicated, who's responsible. There is a person which is appointed normally even in small businesses, small setups and organizations. If you look at a care home, you look at a hospital, you look at a GP surgery, there'll always be a designated person who will be a health and safety expert, who will be a fire marshal, who will be somebody who will be responsible for ensuring all health and safety duties are being carried out and adhered to by employees. Now, there might be routine inspections for safety. There would be, obviously fire drills. There would be some sort of inspections which are done on a yearly basis. And the appointed representative or the person responsible for doing this is then tasked with carrying out these responsibilities in that particular setup at the organization. Now, more about this can be read in terms of guidance, from the HSC website, which is the Health and Safety Executive website. And there's a handout which I'll provide, which basically would give you some details about this particular act. Now, the second one that we want to look at is the Food and Safety Act of 1990. Now, this particular act, was, set out and obviously passed as a law within the Parliament in order to ensure that the environmental regulations are followed by all businesses which are in the business of selling food, buying and selling of food related items. So when we look at the health and social care setup, whether you look at a care home, you look at an old age home, you look at a hospital, a GP surgery, or community healthcare centers, you would primarily see that outlets or in places where there is provision for providing food, distributing food, supplying food, or consumption of food by patients and staff. The staff is required, the employer is required to follow this particular act, and this particular act ensures that it provides a bit of a framework for all food hygiene related requirements that need to be followed to make sure that there are proper standards which are followed in terms of safety in relation to food. And this act ensures that anything which is given out for consumption in places where patients are receiving care is meeting the requirements and the standards of the Food Standards Agency and the act, which is the Food Standards Act of 1990. Now, some of these acts also undergo amendments. So the latest amendment of this act was done in 2009, and it now includes, things which would basically be takeaways and, delivery related items, which can also be, or sometimes when you see food courts and restaurants operating within a large setup like a hospital, they will include these setup and facilities as well, which are covered under the statutory obligation to treat food intended for human consumption in a way which is going to be safe and in a way which is going to be, proper and fit for consumption, for the patients. Now, when we also look at, so again, there's a bit of a handout that I would also provide, and this Food and Safety Act of 1990 essentially will, give you guidelines in terms of what are the main responsibilities of food businesses under this act, that they need to ensure that businesses do not include anything in the food or remove anything from the food or treat the food in any particular way which could be damaging to the health of people who are eating it. The food businesses have to ensure that they are serving and selling it in a way wherein the substance or the quality of the food does not deteriorate and the consumers are getting what is actually prescribed or is actually given on the label. And also the third major point being that the food is labeled, advertised and presented in a way that does not present any false or misleading information for consumers. So these are the three basic, let's say, requirements of the Food Safety Act, and they need to be followed essentially in any such setup wherein we have provision for food being served or food being supplied in this setup. So when you look at hospitals, patient gets food, When you look at care homes, old age homes, you look at patients are served food, maybe lunch, breakfast, morning, lunch in the afternoon, and dinner in the evenings. They need to be observing, this particular part of the legislation to ensure that the food being served is safe and fit for purpose and is not causing any damaging health to people who are consuming that food. Now, there are other regulations which typically tend to be followed, and this one of them is Manual Handling and Operations Regulation of 1992, which is also called the MHOR. Now, this legislation in particular, when we look at, is important because when we look at certain parts of the National Health Service and working of people within this particular sector, there is a certain amount of heavy lifting or weight lifting which is required to be done in case of working with equipment. So when you look at the laundry department, when you look at when supplies are being delivered, this particular act is followed because this ensures that any transportation or supporting equipment which is required to be able to handle load, things like lifting, pulling, pushing, carrying, or moving things by hand or by bodily force, follows the guidelines which are set in order to ensure and prevent injury to a reasonable extent when employees are involved in moving, pushing, pulling, carrying of things within a particular setup. For example, I would put it this way, that if there was a bit of if the care home has brought in a new equipment, and that equipment is to be fitted or installed within a particular room, that equipment requires a couple of people to be able to bring that in because it's heavy. So things like, the care home has decided to set up a small gym, which will have a treadmill, which will have, say, for example, certain bits and pieces of, equipment which will be useful for the, inmates in the care home to be able to exercise and, let's say, do some physical activity. Then in those cases, you would generally see that if that equipment is to be brought in, installed, and delivered, brought in and installed into the care home, you would generally see that it will be done and supervised by people who are observing the manual handling operations regulation, because some of the equipment would be heavy. They would be using, certain equipment like forklifts or trolleys or push cars to be able to bring those things in. And then while installation, certain types of equipment or instruments would be used to ensure that if there is heavy lifting which is required to be done, there is the risk of injury, back injury or any sort of bodily injury is avoided, for the workers who are essentially looking at, doing this particular activity of installing the gym. So any sort of wide range of manual handling activities like lifting, lowering, pushing, pulling, or carrying we need to ensure that there is adequate safety around that, and that is done primarily through observing the manual handling operations regulation. Now, these could be when you're trying to move, say, for example, a patient from, if somebody's had a surgery and the patient is to be, there's a bed changeover which needs to be done, or bed linen needs to be changed, you would generally see two healthcare assistant or one nurse would normally come in. They will move the patient from one bed to the other. And because it has to be done in a way wherein, the patient, does not get harmed, does not get affected in terms of any sort of injury. And it is also, is done in a manner which is effective and safe. You would generally see that people, 2 or 3 people would be required to do that particular task. And in those cases, changing of sheets or linen, which is done regularly when patients, need that particular care in the ICU or in the general ward, they would, be assisted by healthcare assistant or nurses, and they will hold the sheet, if you see, and then carefully lift the patient and put them onto, another bed, and then change the linen and then move the patient back. Now, this is where you would generally see this kind of a regulation, being observed to ensure safety. Now, the third one that we talk about is safeguarding. Now, safeguarding, can be done is a very broad term, and there are lots of regulations which have been introduced around safeguarding. But when we talk about safeguarding, and the meaning of safeguarding primarily is that we are trying to protect children, adults, and make sure that they are safe, and care which is being provided to them is being done in a manner which is conducive, and it is bespoke to the needs of the patient or the person receiving the care. So safeguarding is a term which originally is used, let's say, was introduced in terms of in the NHS or the National Health Service, which basically denotes the measures which are required to protect the health, well-being, and the human rights of individuals which are undergoing or requiring care. Now, these could be children, these could be young people, this could be vulnerable adults. And the idea of having safeguarding is to ensure that they are free from abuse, any sort of harm which can be done to them, and the neglect which sometimes happens with healthcare workers. And we've seen that in the news, that sometimes there are dire consequences of patients being neglected in care home, or people being neglected, not being provided proper care or due care. And this is where safeguarding actually comes into being. Now, there are 6 principles of safeguarding. So we talk about the 6 principles of safeguarding, which everyone needs to be aware of. And these 6 principles include empowerment, which is to ensure that people are being supported, they are being encouraged to make their own decisions, and any sort of consent which is required to be taken, the individual is empowered to take that decision. We look at prevention, which is to make sure that the actions which have been taken do not lead to any sort of harm. So the focus is on prevention to ensure no harm comes of any sort of action which is taken by professionals which are providing the service. We look at proportionality, and that tends to be the least intrusive response appropriate, for ensuring the treatment can be done to the patient. So sometimes when you look at patients who come in and require a surgery, the GP, the consultant, and the nurse, clinical nurse, will go through various options which are available in order to inform the patient about what are the options that the patient can look at. And depending on the severity of the treatment which is required, or the severity of the diagnosis of the problem, you would see they apply proportionality to ensure that the least intrusive procedure can be undertaken to get the patient rid of, that particular problem, or that particular, disease or condition. Then we talk about protection, which is support and representation for those in greatest needs. Then we also look at partnership. Here, local solutions are developed and provided through working with communities and community healthcare centers. And communities, when I say family members, extended family members, of the individuals, play an important part in preventing, detecting, and reporting neglect and abuse. So here, the safeguarding as a principle works, in partnership with various members of the community, and obviously any such support which is provided, or any such neglect or abuse, if it is detected because of the close working in partnership with family members, extended family members, friends, and the various people involved in the community who are providing this care and care to the patient. And last but not the least, in safeguarding, we also look at accountability. So here, accountability is basically about transparency in delivering the safeguarding principles and the practice which is around, the patient receiving, the adequate support which is required, whether it's in terms of sharing information, taking decisions, or in terms of, providing the due care which is required for patients. And that tends to be, the accountability. So people working in this sector are held accountable. And if they feel that the services are slipping, standards are slipping, then obviously the relevant people or authorities, when inspections are done, hold the people accountable in terms of where these slippages are happening. Now, sorry, I should have shown this slide. So when I talked about the 6 standards of the safeguarding, this is what I was referring to: empowerment, prevention, proportionality, protection, partnership, and accountability. Now, one of the most important pieces of legislation that we will look at is the Care Act of 2014. This particular Care Act of 2014 is important is because when we talk about this particular act, it basically, what is this act? It basically is an act, which was passed in the Parliament, which is required to carry out assessments of anyone who appears to require care and support, and regardless of their likely eligibility for state-funded care. So the focus here is that anybody from the members of the public, if they need care and support, regardless of whether it is going to be provided by the, provided by the government, or if the worker, if the staff, if the patient is looking at taking this through a private healthcare, does not matter. So here the Act basically ensured that there is a consistent route which was established to ensure that all members of the public are entitled to public care and support which is needed for them to be able to say get well, or get and receive treatment from the National Health Service. Now, when we talk about this particular act, there are lots of different things that are covered, and obviously the local authorities are involved in delivering of the care and support which is needed, so that it is available to the individual at the lowest possible, or from the highest state level to the local level. Now, the three main principles of this act, which are on the slide that I've explained, are the core basis on why this act has been, introduced. There are obviously some fact sheets around this act. It's an important piece of legislation, quite detailed, and there are lots of different things which are covered in this act. But looking at broadly how they're, structured, they tend to be looking at protecting vulnerable adults from mistreatment and improvement in terms of their quality of life. This also covers the caregivers, and they need to be able to follow the principles of the Care Act. And the main emphasis is on providing care, which is meeting the requirements and needs of the individual. So the Care Act, essentially, when we talk about, tends to be relating to this, the principles of care. Essentially what is where, we need to be looking at, talking about when we talk about, what kind of, let's say, support the individual requires, or care which the individual requires, regardless of their eligibility and background and culture, is what is covered in the Care Act. Now, when we talk about the Care Act also, in this case, closely relates to safeguarding. And when we talk about, its relation to safeguarding, some of the core principles of safeguarding are included in this particular act. But when we talked about these 6 principles of safeguarding, like empowerment, protection, prevention, proportionality, partnership, and accountability, they are a part and parcel of the Care Act. So here, the Care Act is basically providing a legal framework on how the local authorities and other parts of the system should be able to protect adults, children, young people from risk of abuse and neglect. And this particular Care Act, the main reason of this Care Act being introduced in 2014 was to ensure the well-being of people who are in need of care and support services. So the care and support services which are being provided are being personalized and are putting the person at the center of the process. And that is where this Care Act becomes very, important. So again, a bit of a handout which is available on the Care Act, which, is a bit of a fact sheet, and it talks about the general responsibilities of local authorities in terms of prevention, in terms of information and advice, and making sure that these services are being provided to the people requiring care and support at the individual level, and the person is put at the center of, as the center of the process. So this will be a bit of a theoretical understanding that you need to get on the acts and legislation. So fact sheets available in order to ensure that you are able to go through and understand the crux and the core meaning of some of these acts and legislation which have been passed. Now, when we talk about let's say the other acts which are also important. There are lots of them that we would need to study and understand. First, let's look at the Mental Health Care Act of 1983. Now, this Mental Health Care Act of 1983, and in terms of, again, a bit of a handout which is available, but the main point why this act and legislation was introduced was to ensure that there is coverage on the assessment, treatment, and it takes into account the rights of the people, specifically those who are having any sort of mental health disorder. So people detained under the Mental Health Act need urgent treatment for mental health disorders and are at a risk of harming themselves or harming others. And that is why this particular act, was essentially, introduced. Again, a small bit of handout, which I think would be useful, for you to look at studying. Obviously, one of the things which I will share with you now is that if you need to refer to any particular legislation, introduced by the UK government for any particular sector, there is a website that you can access. And this particular website, gives you access to the details of all the legislation, that you need to look at or find. And this is going to be a useful site. Just to show you very briefly, this is this website which we talk about in terms of legislation. Let me just share that screen again. Sorry. Here we go. So this particular website, which is legislation.gov.uk, if you want to find any particular legislation or act which has been, introduced by the government in the UK, you can actually find that legislation here. So if I type, say, for example, Mental Health Act 1983, and I click enter, you really see that all details of that act or that regulation, any amendments which have been done over the years, all will be available. So this is the Mental Health Act. If I click on this, some part of it is, obviously this includes everything that was introduced in the legislation, and it's quite a detailed part. But yes, you can get a good summary of it by looking through various bits, but generally clicking on the introductory text would give you the details of what the act is, when it was passed, and some of the basic details can come up here. Now, because this is a website which is dedicatedly prepared for discussing legislation specifically, so some part of the information on the site is going to be quite detailed, but just as a brief indicator, I wanted to share that, okay, some of these acts, if you want to look at, can be looked at, on the government, website. Now, in terms of the, basic summary of this particular act and what does the act actually do, we are looking at making sure that the assessment and treatment and rights of the people, specifically with mental health disorder, are covered under this act. This ensures that people detained under the Mental Health Act need urgent treatment for their mental health disorders, and they are at risk of harming either themselves or others. And this act would go about protecting and then providing, the basis of how this legislation needs to be put into practice at a place of work. Now, assuming an example here would be that if somebody is not able, because of a mental disorder, is not able to distinguish between what is right and wrong. And sometimes you would see that sometimes people are kept under supervision in order to ensure that they do not harm themselves because they're not able to differentiate right from wrong. And in those cases, this particular act is put into practice, and then obviously proper assessments are done to ensure that any sort of urgent treatment which is required by the patient is then provided. There are some guiding principles of this particular act if you need to go in detail, and they would be covered under the handout which I would provide through Moodle, and this would give you a good summary of the Mental Health Care Act of 1983 and how this is useful in the health and social care setup. Now, there is plenty of information obviously available on most of these acts, and obviously our aim in this unit is not to study them theoretically or generically, our aim is to understand how they are related to the health and social care sector. So the Mental Health Act would be useful for us from a point of view of useful piece of legislation that we need to study. And this is to understand how advice is given to carers and families, specifically in the case of patients who are affected and can be treated under the Mental Health Act of 1983. So sometimes you would see that if there are visiting arrangements which have to be done in hospital, and let's say the patient needs to be the relatives or near dear ones want to come in and see the patient, sometimes you would see that concerns are raised because of the reasons of how the patient condition is or her health is. You would generally see that sometimes visiting hours are restricted or visitors are refused, and this is because the hospital needs to be able to provide proper care to the patient to ensure that it is not putting anybody in the harm's way. And in some cases, what tends to happen is if the patient is not well, the hospital itself will refuse the visitors in order to respect the wishes of the patient itself. And once they get better and they are ready to, obviously interact with the outside world in terms of family members, friends, and things, they would then, be allowed to visit. So in case of emergencies, in case of, urgent requirements wherein care needs to be provided, this particular act would come into place and would be put into action in places wherein patients, are receiving, let's say, services or receiving care because they have mental health disorders. Now, when we talk about the NHS Act of 2006, this NHS Act of 2006 was basically introduced to look at, enhancing, protection for patients from dangers of, healthcare, things like smoking, tobacco, secondhand, inhaling of tobacco, smoke, for example, cigarette smoke, or, providing statutory footing in order to reduce the levels of healthcare associated with infection, to look at providing safer management of controlled drugs. When you look at, people receiving, say, medication or getting medication because of GP prescription, how do we look at improving the control of, the medication which is required to be provided to patients under prescription. So this particular act, basically was introduced in order to ensure that when we look at, let's say, I'll put it this way, when we look at the National Health Service and its structure and how it basically provides, some of the basic guidelines, to patients or, to members of public in terms of ensuring, let's say, I want to put it this way, that in order to ensure that, patients are not put in the harm's way when they're receiving services from, let's say, pharmacies, or, they're receiving other services from the community healthcare centers, things like ophthalmic services. They are being done in a way wherein the infection or spread of infection and, the risk to healthcare or the health of a patient is minimized. So this particular act was then revised into the NHS Act of 2010, and then it became a part of the NHS Constitution. We also have the Human Rights Act, which we need to understand very briefly. There are obviously 13 articles to the Human Rights Act, and what we need to be able to do is that, yes, under this act, you have two main objectives. One, that when we look at the Human Rights Act, people are allowed to make their own decisions. They have the fundamental rights and freedoms which every individual is entitled to. And this in turn, ensures that, any such legislation which the government passes, people have the ability to be able to, the government basically creates those legislations in such a way that it treats everyone equally with fairness, dignity, and respect. And obviously, there are various principles of the Human Rights Act. There are 5 basic principles which basically this act covers, and they include dignity, fairness, equality, respect, and independence. And these basic values are a part and parcel of the Human Rights Act. Now, I have put these because there are lots of different articles which have been introduced over the years, and there are changes to the Human Rights Act which have happened. So there are, the European Convention for Human Rights, ECHR, although we have exited the European Union now, but the ECHR and the Human Rights Acts, which are under the European, legislation, will still be applicable in the UK till 2025. Now, this particular act has lots of different articles, I think 13 in particular, and these articles, guarantee the 5 basic values, which I mentioned, things like dignity, fairness, equality, respect, and independence. So each of the article is focused on talking about rights of equality, freedom from discrimination in detail, and how does it affect, or, if you feel that you are being discriminated against, then you can use this particular act to represent and make a complaint, or go about raising a complaint with the relevant authorities. Now, when we talk about these acts and legislation, we need to relate them in the context of looking at certain regulatory bodies. Yesterday, one of the bodies which I mentioned, and I covered primarily, was the Healthcare Professional Council. Now, this is a body which basically creates the code of practice and the standards which are expected in terms of knowledge, skills, and performance when people are working and delivering services as a healthcare professional. We looked at the Nursing and Midwifery Council. This professional body creates the code of conduct for nurses and midwives, and it indicates the standards which is expected of them in terms of their knowledge, skills, and how they perform their day-to-day duties. We also talked about the Journal Medical Council. Obviously, these are all, various bodies which primarily are regulators within this particular sector. So doctors are a part and parcel of this body. This particular body creates the professional code of conduct and standards which are expected of doctors when they are delivering or discharging their duties as a doctor, and their knowledge and skills and performance in terms of how they are looking at providing these services to the members of the public. So they would be looking at setting the standards which are required of doctors to be able to follow when they discharge their daily responsibilities, whether they are working in a GP surgery, in a hospital, as a consultant, or even running their own private practice. So these particular bodies are essentially responsible for ensuring that you look at making sure that the codes of practice, which is basically the guidelines which have been put in place, are being adhered to as far as the delivery of services is concerned, with regards to the let's say service and care which is being provided to the patients within this particular sector. Now, what I also want to do is very briefly look into one or two things, and I would want to go into the Mental Health Act, which I would want to look at as a bit of a handout, and then also show you, various bits and pieces that you can read to primarily, crystallize some of the understanding for today's session. Now, one of the key things that I want to look at showing you would be, in terms of some additional reading. So if I put some additional reading, because this is a theoretical outcome, and what we want to be able to do is read some key bits of legislation, around these acts. So when we talk about the Foods Standards Agency and the Food, Standards and Safety Act of 1990, this particular website that I've, put would be providing, good reading for 5 to 10 minutes, for you to understand the 3 basic acts that we need to know under, Food Safety Act of 1990. Now, what I also want to do is talk to you about the safeguarding. And when I talk about, specifically the health and social care sector, and we look at safeguarding in general, this bit in terms of safeguarding and the principles of safeguarding are predominantly explained very well on the Social Care Institute of Excellence. And I would suggest that you read this particular webpage, which will give you a bit more understanding on what is safeguarding specifically as far as health and social care is concerned. Then I want to talk about in general about the Health and Social Care Act, which is something quite important. And what we want to do is look at what and how and what are the various areas in which this particular act can actually, help in, promoting, the safety guidelines which are required as a safety net, which is required for the patients. So when we talk about the, let's put it this way, the Health and Safety, the Care Act of 2014, I would expect that you go and read this particular fact sheet, which is to look at giving you some guidelines and inputs about the Care Act of 2014, and then the further amendments which have been done on the 2016. So if I show this to you very briefly in terms of how we these are organized, and whereabouts would you go about finding and reading this, is the bits which let me just quickly show you, and then we will go into the care principles that I want to discuss with you as a last part to this particular learning outcome. So let me just switch you over to the browser. So when you go into each of these sites which I've listed here, so this is the 6 principles of safeguarding. This will be a good read for about 5 minutes, and if you read these, and your responsibilities as a health and social care person within the sector would be quite useful. You look at the Care Act fact sheet, which I've given here, which is quite important. And I think the role of what the Care Act does when you're looking at working within this sector would be, useful 5 to 10 minutes read. There is something about the Mental Health Act and how is it related to health and social care. And, the main bits that you would want to understand under the social, health and social care sector, and the unit that we are studying are summarized nicely here on the NHS website. So this particular website would provide a good reading, additional reading. So I'll put that here. And then in general, the Mental Health Act 1983, for those of you who are looking at reading this in a bit more detail, can actually read about this particular act in detail when we look at this particular handout, which I will provide, and this will give you all the details which are required to understand some of this act. Yes, I've got, okay. So then what I want to do is also look at now covering, just very briefly the safeguarding, the care standards and the principles of care standard. And this is where I would be sharing this particular handout with everyone. So what I would do is, if I just quickly share this handout and bring it out on the screen, then the idea would be to discuss this in a bit more detail. So if you just give me 1 second. So when we talk about these care standards, we are talking about the care and treatment which must be appropriate and should reflect, the needs and requirements of the users, the preference of the users. And what we want to be able to do is basically cover, this care standards, which is, important as far as the legislation is concerned, the care standards. This is something which basically, is followed through from a point of view of, offering these services to patients from the National Health Service. So when we talk about the fundamental standards, these are the ones that we will be talking about. So UK care standards. Let me just quickly bring this handout up. So if I just So any questions on this before I show you the case standards that we discussed so far? Any questions from anybody? All right, okay, so let's start with these care standards. And what we need to do is go through these, because again, a bit theoretical, but what we want to be able to do is go through these care standards. I'm just quickly organizing that. If you give me 1 second. Okay. There are, as I mentioned, 14 standards that we need to be aware of. And I'm just highlighting them on the PowerPoint slides so that you don't need to, it'll be easier for you to reference it from one place. And this is what we will discuss now. So let me just shift you over. So when we look at, after this additional reading, what I've done is I've inserted a few slides here. And these few slides basically talk about the care standards, which are actually standards which the CQC monitors, and all organizations are required to, provide care as per these standards, which is required by law. Now, the CQC, which is the Care Quality Commission, is a regulator that monitors these and inspects these care standards in all organizations, essentially when they do inspections once in 3 years, or when if it's a new provider, a new setup once every year. Now, all providers within the NHS, even the NHS, the social care providers have to be registered with CQC, and they need to be conforming to the standards, which are the care standards as they are prescribed in England and Wales. And there is obviously an adaptation of this in Scotland, Wales, and Northern Ireland, where there is an independent regulator like the CQC in the devolved countries. So I've got 1 or 2 people which have raised hand. Faiz, yes, I'm happy for you to leave a bit early, no problem. Thanks for letting me know. And Aslam as well, that's absolutely fine. We are just a few minutes away from closing the session, but just the last bit of discussion that we want to do in these care standards. Now, in Wales, the equivalent of CQC is the Care and Social Services Inspectorate of Wales. And I mentioned yesterday that in Scotland, you have the Care Inspectorate and the Healthcare Improvement Scotland agency, which basically act as regulators in the healthcare sector. And in Northern Ireland, you have the Regulation and Quality Improvement Authority, which is RICSA, and they basically look into maintaining these care standards. Now, when we talk about what are these care standards, these are fundamental standards which all organizations need to adhere in terms of delivering care services to patients, and this is required by law. This is expected that, it is very clearly expected from these standards that everybody understands these standards and they are able to implement these and observe these at their place of work. And the employers, obviously make sure that the training is provided to staff workers who are working within the sector when they are providing the care and delivering the care to the patients. Now, we've learned about the person-centered approach. So in this case, the person-centered approach is one of the standards which basically ensures that the treatment of the care that you're receiving is tailored to meet your needs and preferences. We also looked at dignity and respect, which is a part and parcel of, the Human Rights Act as well. And this is to ensure that everybody is treated with dignity and respect at all times while you're receiving care. And this dignity and, respect, when it is being observed and provided to you when you're receiving treatment, it is to ensure that your privacy is taken care of, you're treated as equal, and you're also supported in terms of making independent decision in terms of, certain aspects of the care that you're receiving. Consent is one of the standards which basically ensures that anybody who's acting, if it's a minor, then in this case legally, some sort of a documentation or document is available to be able to allow parents or legal guardians to be able to make decision, and a consent is to be taken before any sort of care is provided. Now, this is in the case of minors and also in the case of adults. Like sometimes if you're undergoing a surgery or an operation or receiving some sort of treatment, you're normally asked to sign a consent form that you're happy and you've understood what would be the treatment and what would be the various steps which will be taken in terms of providing this treatment. And this is the consent form that you sign, and is a part and parcel of one of the UK care standards. Safety, as the word is self-explanatory, you should be given treatment which is safe and does not put you into harm's way. All risks have been looked at, risk assessments have been carried out, and the providers which are providing this care are ensuring that all health and safety guidelines are being followed and met before the treatments are provided. Safeguarding, which is safeguarding from abuse. You're making sure as a provider that nobody is being abused and improper treatment is not being given. The patient receiving the treatment is not being neglected. There is no degrading treatment being done, and obviously ensuring that independence and dignity is taken into account when providing the care. Food and drink, you must be able to obviously have enough food and drink at the place of work. Specifically, we see in the news sometimes abuses and discharge of responsibilities not being done by the staff within a care home. And I think in the last couple of years, we've seen a lot of investigations done by Panorama, which basically show the patients or the care, elderly people not being treated well within care homes. So they are being starved, or food and drinks are not being given on regularly and things like that. So those are bits which CQC goes and inspects to ensure that, the people in a particular setup, if they are receiving care, they're also being properly fed, and obviously, food and drink is readily available. Premises and equipment are inspected to ensure that nothing is, causing or will cause any harm or risk to the treatment which is being provided, care which is being provided. The equipment being used is fit for purpose and is regularly tested and maintained. Complaints should be, you should be able to freely and without any pressure make complaints. If you're not happy with the care or treatment you're receiving, you should be aware of the complaints process, and the provider should be able to provide you the details of how to make a complaint and who's the adjudicator and how the complaint would be investigated is an important part of the care standards. Then we also look at, good governance. One second, screen seemed to have frozen. We also look at, good governance in terms of ensuring that, the provider takes care of and has proper plans in place to ensure that the standards and the legislation are being met. The quality of care being provided is meeting the standards of CQC. There is safety and health and safety procedures being applied, and the next standard is staffing. So ensuring that the provider has enough staff to be able to, provide these services. And these services which are being provided are fit for purpose, and the staff has proper training they have received over the years, and obviously are being properly trained as they are required to maintain their skills and obviously provide care to the patient. So these are the care standards, which are required to be observed and, required to be, followed by guidelines which are set by the CQC Quality Care Commission. And that is where, we need to be able to understand these care standards from a point of view of, requirements to be observed at a care home or at a setup which is providing treatment and care to the patients and members of the public. Now, this is where we're going to end today's session. So if there are any questions, I'll be happy to take. and feel free to ask me now. Any questions on today's discussion? Any questions that you have, you can ask me now, either through by unmuting your microphones and also through the chat route. Right. If you think of any, what I will also do is make sure that you are able to essentially, get hold of these handouts, which I'm going to share from Moodle. And these handouts will primarily give you some bit of additional reading, as I've explained, on the topics that we've covered today, specifically the current legislation in this sector, the UK care standards that we need to be aware of, and also handouts and some additional reading material, which will be useful for you to get a bit more understanding on today's learning outcome, which is understanding current legislation and professional code of practice, which is, created and, maintained by some of the bodies within, along with the regulators in this particular sector. So we'll continue our journey on learning outcome 3 and the assignment discussion next week. Till then, if you have any queries or questions, you can drop an email to me at litc@ukversity.co.uk. And the copy of this presentation and some of the handouts that we've discussed would be then available on Moodle for you to be able to access. Thanks so much for joining, and take care, and I'll see you next week. Thank you.
Thank you.
Thank you.
Hello.
Yes, hi. Any questions that you
Are you
have?
hearing me, please?
Yes,
Yeah.
Percy, any questions?
With this topic we studied today,
Yes.
are we going to expatiate on this element that you just given as an assignment, like talking about regulation, health and safety, art, care, food safety, food, and all this? Are we going to analyze or then on our own as an assignment?
No, there is no analysis required in this particular task. Most of the command verbs for the learning outcome is explain.
Okay.
This is a theoretical learning outcome. So what you'll have to do is, when it talks about explain current legislation, there are obviously about 21 different legislations which I've covered on the PowerPoint slide today. There are handouts for some of them which will give you more details. But when you do the assignment later, you're going to be looking at covering maybe 4 or 5 different legislations which we can relate to the health and social care sector in general. So things like the Mental Health Care Act, looking at the Safeguarding Act, looking at, for example, the Care Act of 2014. These are which are going to be the mainstay when you say explain the current legislation, because they're related to health and social care.
Okay.
I have listed down some of the others, like manual handling, offer operations, RIDOR, health and safety. They are generic legislations which are also important in this sector, and they are followed. But they might not be directly, something which is related to this learning outcome. So the idea there is to look at all the acts that I've explained and pick out the ones which you feel are relevant. I have given some idea on the 4, 5 broad ones which are relevant to health and social care sector, and those are the ones that I would expect you to cover in the assignment. Because it talks about explain, so you're theoretically explaining them in 50 to 70 words. What is the act, what is the legislation, and what are the key principles, and that would do it. The second part talks about the care standards, for which I will provide you a handout, and the care standards that I've listed on the slide, the 15 standards. Again, it says explain how they are used to promote the best practices in the sector. So again, you're going to be explaining the Care Act standards, the 15 of them, in your own words, but you can't change any in terms of the meaning of it. So you'll have to write them as it is, and that would cover this particular task.
Oh, okay.
Is that okay? And then we talk about the relationship between the healthcare values and the care values. So you're looking at discussing the 6 principles of person-centered values, PCA, that we've covered in the previous unit, and list down the 6 care values that we have seen out of the care standards 15, list down about 6 that we've covered, specifically things like when we discussed, safeguarding, we talked about dignity, respect, privacy, individuality, independence. Those would be the ones that you list down. Again, that command verb is explain. the relationship between the two. So care, when it is being provided, has to be linked and bespoke to the patient who's receiving the care. So you'll have to look at the care standards, which are 15, and then pick out the 6 values that we've talked about, the person-centered values, and only talk which are the ones which are essentially, common, to be able to, discuss that. And that would help you cover, the explanation in terms of relationship between the health values and, the care values. So that will cover that particular task. So it is again an explain option. The command verb is explain, and that would typically mean that, you are looking at explaining the relationship between care values and healthcare values, which we have covered in person-centered approach. So all the learning outcomes of this particular, assessment criteria of this particular learning outcome is focused on explaining. So theoretical explaining, but you're looking at, because there's lots to read and lots to cover, you're looking at putting things down in your own words by using paraphrasing without altering the meaning of it, but covering things which are directly relevant to the health and social care sector.
Oh,
Is that okay?
yeah.
Good stuff.
Okay,
Any other
thanks.
question? No problem. Any other questions? Okay. So if there are no more questions, or if you think of any that you can come up with and you need some more information, do drop me an email and I'll come back to you on that. So for now, I'm going to try and end the session, and hopefully, we will catch up next week with regards to studying the learning outcome 3 for this particular unit. Thank you, and bye for now.
Bye.
Thank you.
Upside reading, all right. All doctor. Yes, sir. No. Only doctor.
Start on the top, work your way
Yeah.
down.
No, no.
The next job, clean the separators
Yeah. Clean that one.
with the waste, clean the rings, and clean underneath the ring here.
All
They're
right.
very dirty underneath. So,
Okay, try. Yeah.
have a good clean while you've got spare time. Start at the top, work your way down.
Yeah.
Yeah. Just keep cleaning all day, no problem. Nobody, no trouble.
Yeah.
Just keep going.
Reverse. Now, wait. Now,
Yeah, keep going all day.
reverse hand. Hand of good feeling. Hand of good feeling. Stop. Like going, don't stay clean. No, yeah. No, don't stay hand. Like it. Look, my same problem. Hand.
Yeah, wash your hands. Wash your
Ajay, how are you? Ajay? पता नहीं क्या हो गया कावड़ ही हुई है कावड़ हुई है हो जाए Mm.